think that there's a couple that really stand out. I think one is, we're a high volume, high acuity program. So you're going to see things that you might not get an opportunity to see in too many other places. And that involves trauma, that involves very sick kids, that involves kids with chronic illnesses. Anything that you can imagine, we're pretty much going to see it here. I think that the graded autonomy that we give our fellows is also something that's very, very important, and I suspect Dr. Klein is going to talk more about that. One thing that I really wanted to focus on is our sim program, I believe, is second to none. I've had the privilege of training and working in some places that have outstanding simulation programs, and yet I think that this is the best one that I've been a part of, both with our facilities. We have a 30,000 square foot sim facility that is full of high-tech models, high fidelity and then low fidelity task trainers. We do all kinds of things with that. We have so many opportunities to learn, and there's a reason that pretty much every one of our fellows does the simulation elective. It's technically an elective. Our participation rate is over 100% because some folks do it twice. It's an integral part of the program and something that I have never seen anywhere else and that I am super proud that we have.
So I think that people might hear Akron, Ohio and be like, where is that place? What's going on? And be more attracted to other locations that have more, name fame. But Akron is unique. We have a higher volume than some of those bigger name places around us. We have a huge catchment area and are essentially supporting almost half of Ohio with our transport services and the patients that we see. We have a great relationship with the families that we serve, and there's patients that I've seen throughout my years as a resident and then now as a fellow, and it's been awesome taking care of them. I don't think there's anything this program lacks that other programs would offer. We have an amazing suture team that gives us excellent practice in our suturing skills, but also helps take some of the patient load off of us. We have an amazing pediatric psychiatric emergency center in the ED that, again, is an invaluable resource and helps us navigate those troubling and difficult cases. And we're also a level 1 trauma center, so we are, the main trauma resource for the region and have a bunch of educational opportunities with that as well. So really, we have so many things that you wouldn't necessarily think that a place in Akron, Ohio has, but we are definitely the place to be and have all the resources any applicant would want.
I think our program stands out because we have a graded responsibility system for fellows. So when they come in as first-year fellows, they get to be paired one-on-one with a PEM attending during time in the ER to learn how the system works, how to take care of kids, but also a little bit about how do these attendings interact with families, how do they interact with nursing, subspecialists, so that fellow can then take the favorites of all of that and make it part of their own. As the fellow gets more comfortable in the emergency department, they'll get more autonomy, so they'll start seeing patients with some indirect supervision. So they always have a PEM attending next to them that can answer questions, help them with problems, kind of talk about cases, but they're the ones making the decisions. They're the ones deciding what's best for that child and that family, and they're acting upon that. And then as they get even farther into fellowship and they're almost done, they're doing some time where they're acting as the attending. They still have an attending in-house, but that attending may be 5 minutes away instead of sitting in the chair next to them. So they get a little bit more of that feel for what it's like to be the person in charge and problem solve, talk about resource management, figure out how are we going to work through the system and the number of kids that are in the system right now. And this makes our fellows be able to walk into an ER anywhere in the country and be able to be efficient and take care of kids.
So preparation for emergency medicine fellows going out into the world is really our primary focus of the fellowship, because this is ideally what they're going to be doing for the rest of their lives. And what that means is you have to be comfortable seeing patients, seeing a high volume of patients, seeing very sick patients, but also balancing your resources and figuring out where things are going to go, how you're going to prioritize things. And that is very much assisted by the graded autonomy that we have. And so as early as your second year of fellowship, you're going to have a pediatric emergency attending next to you, but you are making the decisions for your patients. You're making the medical decisions, you're making the resource allocation decisions, you're running your part of the ER. And you're still very, very, very supported. We're not just saying, hey, good luck. That might not be fun for anybody. But you're getting that hands-on experience to do everything and to manage everything. And when you have a question, that's what we're there for. But the other piece of that is that as attendings, we also model that behavior. We don't just try to do things ourselves. We ask our colleagues, we'll ask our fellows, we'll ask our residents, because a good idea is a good idea.
I came to Akron Children's as a resident years ago, and I joke I haven't found a good enough reason to leave Akron, but this place is truly a family. You're gonna meet people that are gonna become part of your work family, and they care about you as a person, and they're gonna want you to succeed in whatever avenue of the PEM world you decide that's gonna be. And we are gonna try to keep moving your education forward for whatever you need to get to the next step.
I mean, emergency medicine, for lack of a better term, is a team sport. And by learning that, and by learning that, okay, like, we don't get to have egos here. We really need to work together to help kids as best we can. You know, that plus the autonomy, that decision-making, that, hey, you're going to be managing the department, you're going to be managing those patients. Once you are done with this fellowship, our goal, and I believe our outcome, is that you can walk into any pediatric emergency department in the country and run it successfully. First, and probably the most important thing, is my wife's family is in North Canton. We were both sort of sick of being away from our families. My family is up in Providence, Rhode Island. You know, there were no jobs available up there, and so we really wanted to be in Northeast Ohio. And so was looking at jobs and then talked with some folks up here, and it turned out they were looking for an associate program director for the fellowship. And that, like, if you had asked me even back in my residency what my dream job was, it would be specifically to be the associate program director for a pediatric emergency fellowship. That combination of things, finally being close to family again, and having what I've always wanted in terms of my job, in terms of my career, that made it a no-brainer. I mean, if you're a fellow looking at Akron Children's, the biggest thing that I can say to you is, look, I think, based on my experience, I think that you are going to get the best possible preparation that you can get for your career here. I think that you're going to have a lot of good choices. You've made a really good decision with your life. PEM is the best. You're going to have the best people. You're going to have the most fun, pretty much regardless of where you go. But what you're going to have here, you're going to have opportunities that are really kind of unparalleled in terms of patient care, in terms of simulation, and in terms of autonomy. You know, PEM docs, like I mentioned before, we like to be in the center of things. Not necessarily the center of attention, just the center of things. And you will have that opportunity here. You will get the chance to grow, you will get the chance to learn, and you will get the chance to lead. And I think that's what sets us apart. So give us a thought. We'd be really excited to have you.